Parish. Our demographic is for highly older citizens. In fact, 25% of our population is over the age of 60. You combine that demographic, a higher elderly population, with the fact that we know as a state, Louisiana, is one of the unhealthiest states. We have a lot of people who deal with the comorbidities, the diabetes, the high blood pressure, the kidney problems. That is why I think you see the very large hospitalization rates and the higher than average death rates where we are here in the greater New Orleans area. I want to remind everyone that we continue to do testing at the Ilario Center site, 250 a day. There is some confusion out there that we are asking for insurance cards. We are not asking for insurance cards. You have to be a Louisiana citizen over 18 years of age and exhibiting symptoms. That is the only requirement. It has been noted that we are, especially that first weekend, some of the test results are really lagging. We have been after that every day, trying to get those test results, especially for that first weekend. If you have not received your test results yet from the Ilario Center, please dial 504-658-2299. Again, the number is 504-658-2299 for your results. We want to also remind everyone, for those of you who are needing food distributions, to call 211 every day. They are letting people know where the food distributions are. Our council members are taking a real aggressive approach on this. They are working on a drive now to deliver even more food to people and to match that need with the food supply. So our council members are still working on that, and hopefully next week we'll be able to deliver even more food using their own staff and some volunteers who are willing to get involved in that. Of course, no contact, just picking up food, dropping it off at someone's doorstep. We want to make it as safe as possible. So I need to commend our council members for really taking that initiative. I also want to point everyone to a Keep Calm Through COVID number. We know this is stressful times. We know there's a lot of anxiety, and we encourage everyone to reach out to this mental health line 24/7, 1-866-310-7977. We're in communication with our hospitals, again, asking people to donate blood. Please donate blood. There are very safe ways that you can give blood, so please consider that. And please, I'm going to personally ask that you consider giving to your nonprofit of choice that you know is on the front line of fighting this disease in our community. Currently, my nonprofit of choice is Second Harvest Food Bank, because I know they're in the midst of expanding. I see them at work. I see the volunteer effort. I see the Louisiana National Guard there. The federal government is helping them expand. So $5, $50, $500, whatever you can spare really helps people get meals to the people who need it. I want to encourage everyone to stay in touch with us in Jefferson Parish, www.jeffparish.net. You can also text JP Alert to 888-777. We also have many social Instagram channels on social media, Facebook, Instagram, and Twitter. And then, of course, for other COVID questions, I've also referenced this number a lot to call 211. The state has recently started a site, coronavirus.la.gov, so please look at that site. And before I finish, I want to, again, thank so many people, especially our medical community, our medical providers. They are the front line, our first responders, our people who are in transit, our people who are at the prisons, all the people whose daily job it is to go to work, and who are really on the front line of this. I just want to thank you. We're still in the midst of this. One day soon we're going to see the light at the end of the tunnel, but this is a life-changing thing, and you can always remember that you were part of helping to solve this and helping to keep that death rate down. So with that, I want to call up next, I want to invite Dr. Joseph Cantor up to speak, and then I'm going to ask Dr. Jerry Satanovich. He has some updates from a governor's proclamation the next day. Thank you.
Thank you, Madam President. Good afternoon to everyone. President Lee Sheng has been very clear throughout this that it's going to get worse before it gets better, and that's exactly where we are now. So today you saw the largest increase in cases that we've had statewide. and that's on the shoulders of another big day of increases yesterday. I do want to give a little bit of a word of caution. If you'll notice, the case count didn't go up as high over the weekend, and then it shot up. A lot of the cases that come in now are swabs that were done perhaps 4, 5, 6, 7 days ago. And so it's difficult to put a lot of stock in how much the cases change day by day. It's more important for us to be looking at trends. But there should be no doubt about this. The trends are continuing, unfortunately, along the projections that we've been running, which is capacity is very close to nearing 100% in the hospitals and our ventilators. And that makes us all very concerned. So to mention a few of the challenges that we're facing now, first is the turnaround time on the tests. What has been happening in the commercial labs, LabCorp and Quest, we feel is completely unacceptable. Completely unacceptable to have a turnaround time of 7 or 8 days in this situation, and that's been well communicated. But I think it's worth saying here as well. Giving us concern also is the supply of ventilators and PPE. The governor's been very clear that we're looking at very hard dates of when we anticipate both of those to be at max supply. With PPE, we do have shipments that come in to the warehouse in Baton Rouge from the federal stockpile, and those shipments typically get turned around and emptied by the next morning. So I think that's why donations like Lowe's, as was mentioned by the president, are so important. And it's also important for private folks not to be hoarding these type of PPE supplies. For hospital capacity, we're closely approaching the date when acute care beds will be at their max in this region. And that's why you see individual hospitals working so hard to expand how many patients they can care for in their 4 walls. And that's why you see this massive undertaking in the Memorial Convention Center to provide a space to offload some of the less acute patients in the hospital. And that is a regional asset. So there will be plenty of patients from Jefferson Parish who will make use of that space. And it'll be staffed by a combination of healthcare workers brought in from outside the region on contract and local healthcare workers volunteering their time towards that. If you go around town the past few days, you kind of get the sense that people are outside of their house a little bit more than they were last week, and I wanted to address that. It's not good, and it's not what we need to be doing right now. If you look around at the sacrifices that we're asking other people to make. And for example, we are asking families not to be at their loved one's side if they're in a hospital right now, because we don't want visitors to introduce the virus. We're asking families who are mourning the loss of a loved one to not have the type of funeral and send-off that they would normally want for their loved one. We're asking restaurateurs and other folks to close their business. These are incredibly large sacrifices we're asking people to make, and that should be a message to everyone else that we're still deep in this, and now is not the time to let up. I want to say that one more time. We are not even halfway through this, and if anyone has any doubt if it's okay to ease up on the social distancing, it's not. We need to stop the spread, and we need to continue staying at home. And then to just reiterate one more item that President Lee Sheng mentioned, cannot tell you how heroic our healthcare workers have been in this, the folks that are working in hospitals, and this goes for techs, for therapists, for nurses, for docs, for janitorial staff, administrators, everyone. I spent some time in a local hospital last night, and people are doing incredibly heroic work, and if there's any way to show folks love that work in a hospital, drop a meal off on their porch, donate some food to a hospital, it goes a long way right now, because these are the folks who are going to be saving lives as we go through this. Thank you.
Good afternoon. I'm Dr. Jerry Satanovich. I'm the Jefferson Parish Coroner. During this time, in addition to the normal death rate in Jefferson Parish, we've had, as of right now, this afternoon, about 80 deaths from coronavirus. And my heart goes out to all the families and the victims of this. That said, there are several reasons that have made it where the body storage capacity at funeral homes and hospitals and the coroner's offices are overwhelmed. To the point where, in Jefferson Parish, we've had to procure a refrigerated storage unit to assist us with holding bodies. A lot of families are having difficulty in making decisions, as Dr. Cantor said, because of wanting to do what they would consider a proper burial. I will mention that yesterday Governor Edwards issued a proclamation that directly addresses coroners and funeral homes and what's going on here. He has two main parts. Number one, he's requesting that all burials be done within 3 days. And number two is they're limiting the number of people attending, whether it's an indoor service or a graveside service, to 10 people. Thank you.
Thank you, and I appreciate that from both of the doctors, and I did want to reiterate what Dr. Cantor was saying. I believe that the weather is beautiful, that people are getting kind of cabin fever, and we're a people who like to communicate with one another, and we're a people who like to celebrate life with one another. And so there are a lot of creative ways that churches and schools are wanting to get out and meet one another, and they're calling and they're asking us if they can do it, and the answer is no. We still need to be staying at home. Any drive-through kind of activity, it's going to be hard for you to keep your window raised up when somebody's right on the outside of your car looking to talk to you. You're going to roll down the window, they're going to lean down, they're going to talk to you. There's going to be a close exchange. We don't need the people calling to complain about that. That is not where we want to put our public resources on that. It's going to make the sheriff's office have to manage it. It's going to make our staff have to manage it. So I know it's gorgeous outside. Please go out just with your family member. I see couples out, but no organized activity, and we're asking everyone to cooperate with us on that. With that, I would like to invite Sheriff Joe Lopinto up, please.
Thank you, Madam President. Many of y'all have been asking how the effects of the Sheriff's Office has been going with the COVID-19 outbreak. Given an update on that, we have approximately 80 of our deputies that we have been tracking over the past 2 weeks. When I say deputies, that could be any of our employees, our civil employees, correctional employees, and operations. Out of the 80, approximately half of them have tested positive for COVID-19. Have several tests that are pending. Probably about 20 are pending, and 20 that actually came back negative, but had additional symptoms that kept them out sick. Good news is we have some of our deputies that are actually back at work, have had negative symptoms for a period of over 3 days, have recovered from the virus itself, and have returned back to work. But on the opposite side, we have 5 that are hospitalized, 2 in very serious condition at our hospital, and our prayers continue to be with them. The Sheriff's Office is still handling calls for service. Obviously, medical calls are up greatly right now in this time of need, but they're really stepping up to the call. I'd be remiss without thanking them, our operations staff, our 4 districts that are out there working. Our correctional staff is still at the correctional center handling their day-to-day opportunities on 911 that have to work during these difficult times and take care of this. This is a medical event, not necessarily a law enforcement event, but I want people to understand the ramifications that happen with this. We've seen the post on social media talking about, how many deaths we have worldwide, how many automobile accidents we have worldwide of different diseases, and how this compares. And we don't have that many cases here, so why does it really affect us? Well, it doesn't affect you until you have somebody that's close that's actually really affected with it. And I put it in perspective from a law enforcement perspective. In 2019, just last year, we had 60 fatal automobile accidents in Jefferson Parish. 60. Yes, there was 300 and something fatalities worldwide, and we have a lot lesser number. But we had 60 just in Jefferson Parish fatal automobile accidents. And most people don't think about that because they didn't know someone that was a member of those 60 people. We had 73 deaths in the last 2 weeks in Jefferson Parish. When you put that into perspective, you understand how serious this is. This can happen very quickly. Our deputies are going out to handle a lot more deaths during the day because of people are losing loved ones. They are not able to go visit their family members that are in the hospital. We're asking people to stay inside for a reason. Hopefully this never affects anybody in your family. Hopefully it never affects a person that's closer to you. But we have people every single day that are really affected about this, not only with our JPSO family, but our Jefferson Parish family. If you can heed the warnings, we can't stop everybody from being outside, but we understand what the purpose is, and it's time for all of us to be together. Stay inside. Let's get past this together. Thank you.
Thank you, Sheriff. Next up, I'm going to ask Mr. Todd Murphy from the Jefferson Parish Chamber to discuss the big stimulus package that was passed. Thank you.
Thank you, Madam President. Todd Murphy with the Jefferson Chamber, and I'm here today to also represent my partner Jerry Bologna at JEDCO, Tim Coulon with the Jefferson Business Council. All of our employees are working from home and working remotely, and I can tell you that our emails are blown up and our phones are ringing off the hook. People are very thirsty for information. As our community is sickened by this virus, literally, so is our economy, and we're working very diligently with the people behind me, our local officials, our state officials, and especially our federal officials to get this money down into the local communities. You're I'm sure very familiar by now of the CARES Act that was passed. That's put a lot of money, or will put a lot of money into small businesses. It's not a perfect bill, but it is something that is going to offer tremendous stimulus to get people back to work. The federal officials, the SBA, Small Business Administration, is working with the banks right now. There's been a couple hiccups, but we think that this is going to be worked out quickly, and it'll get money back into companies to hire people, to get the lights on, to get the rent paid. So my message to business owners is that if you have a business and you're contemplating, should I lay people off, what should I do, please contact us at jeffersonchamber.org. You can go to jedco.org. We're also working with our regional partners at G&O Inc., trying to get this information out. Contact your CPA, talk to your attorneys. There are ways to do this that can get you back up and running as your business should be and get you back to prosperity. We're also proud to announce that yesterday the governor's office came out with a plan for companies of 10 employees or less, and you can apply for loans there as well at the State Department of Economic Development. That's led.la.gov. And they've got $100,000 loans. All of these loans are at very small interest rates. The CARES Act has a Payroll Protection Act that if you use that money, and there's certain stipulations under it, but if you use it to hire people for your payroll, for your rent, for your utilities and your insurance payments, it's a forgivable loan. So I just urge business owners, please research this information, take advantage of it so that we can keep people at work and get people back to work as soon as possible. But go ahead and get ahead of this now, apply for those loans so that when we're able to go back, we can go back. If you're an employer and you're looking to hire people, you can post that at worknola.com. And if you're somebody that's looking for work and you're currently unemployed, the CARES Act is going to take care of you there, first of all, but when it's time to go back to work, look at worknola.com. There's a lot of jobs, local jobs, posted there now where people are looking for people to go to work as soon as we're able to come back outside. So I would just thank you and ask everyone to please be patient, and let's start working behind the scenes of just how we're going to bring our economy back when this is all over. Thank you very much.
Thank you, Mr. Murphy. So in addition to such strong leadership on our council side, Jefferson Parish is extremely blessed to have 6 incorporated areas represented by our mayors. And we've invited all of our mayors here today. So first up is going to be Mayor of Gretna, Belinda Constant, followed by our Mayor of Kenner, Ben Zahn, Mayor of Grand Isle, David Carmadel, Mayor of Harahan, Tim Baudier, Mayor of Jean Lafitte, Tim Kerner Jr., and Mayor of West Wego, Joe Peoples.
Thank you, Madam President. I just want to first say thank you to President Cynthia Lee Shang and, of course, all of the elected officials at the parish level for doing the job that they're doing to keep everyone informed regionally about this crisis at this time, which includes municipalities. As mayor of the city of Gretna, I know I take questions from our constituents every day about certain aspects of what's going on in our city, and I want the people to know that when the parish speaks, that includes the municipal incorporated cities such as the city of Gretna. On behalf of myself and all the elected officials in Gretna, as well as Chief Lawson and the council, we want our constituency to understand that government is open and we are doing business and providing services daily for the people that we serve. Most of the information that we're passing out and giving out to the people is through a Facebook live feed, other social media, as well as our website. So if anybody in the city is looking for specific questions to be answered or specific information, please look daily to Facebook and social media as well as our website. For seniors, for people that are not technology savvy and really want to speak to someone, we have a phone that is ringing just as it does on any typical day. Please call the City Hall number, 363-1500, and someone will answer the call regardless of what the question is. Please do not hesitate and reach out to us. I know at this point in time there are a lot of people that are frightened, especially some of our seniors and some of our people who are dependent on social services and public services. We're here to continue to meet your needs, whatever they are. Please don't hesitate to call us and speak to us about the things that you are concerned about. We want you to know also, especially our senior community, I know someone spoke to it just a minute ago. I know the parish administration, as well as their elected officials, is working on a project with Second Harvesters food program. The city of Gretna is absolutely involved in that program with them, and we are interested in meeting the need for anybody that is signed up with JCOA or with People's Health, which is the city of Gretna's senior center, that we will be participating and will be delivering those meals. So please stay tuned for further information about that. And as always, please adhere to the pleas that you're hearing from the people that have spoken before me. We can flatten this curve. We can shorten the time. Please stay socially distant. Please understand that there are people that are working every day to save us. Please help us save them, the people that are working diligently with you in the medical care profession. So thank you, Cynthia Lee Shang, again. And with that, I'd like to call on Mayor Ben Zahn.
First of all, thank you, Cynthia. Appreciate you putting this together and all the parish council. It's important that the cities have an opportunity to do this press conference and let you know what's going on. We do a lot of things through our personal, our public service announcements, but we also want to do something like this, so thank you very much. Since day one, the city of Kenner has had their EOC in place. We have had an action plan which has kept our continuity going for the city of Kenner. Full support of our city council, of our chief of police. They have all been fantastic on doing what they had to do. Throughout this time, we have moved operations from day one when this started from City Hall to the Pontchartrain Center, then back to the EOC. We will continue to keep the EOC open. Of course, if anyone from the public needs anything, we are there. All of our phone lines are still on. City Hall's phone line is 468-7240 to the mayor's office. All the council numbers are on. Each and every council person still has their assistant working, even though we work from remote sites. Our departments, all of our directors, everyday personnel, the Kenner Police Department, Kenner Fire Department have been awesome. We continue through social media to keep you updated. We have our meetings. We do everything to keep everyone updated, and we'll keep the public informed as we go through this. While certain recreational sites have been shut down, that is for the help stop spreading this. It's important that we keep those things shut down. Our walking paths are still open. Our dog park is still open. We did shut down Lake Town just this past Monday, but we had to. The boat launch is still open, but we can't control the amount of people on a weekend. When you have 200, 250 people in Lake Town, it becomes an issue. We've gotten nothing but good response from the constituents on that, and it's important to thank the Kenner residents for their cooperation. Very, very important, because during this time, it's you cooperating with us. We will respond to everything. All essential services stay on the street. Kenner Police Department has not turned away. Kenner Fire Department has not turned away. On the way here, we have a fire going on right now on David Drive, and the Kenner Fire Department is out there. So our fire chiefs, our police chief, and all of our council are working hard along with each and every person in the city of Kenner. I want to also thank our civil servants. They have not stopped. It's important to thank them because those are the field crews that are out there each and every day. I just want to again stress social distancing, stress public safety, keep yourself away from people. It's very important that we all keep doing that. This is a time that we have to get through. We will get through it. Like I said, we will continue to have every service in the city of Kenner available to you. You might not be able to get to us face to face because nobody wants to do that right now, but personally through our telephone service and through our iPads, through our computers, we are making sure that we are keeping those services going. Again, this is important to thank Cynthia for putting this on, our parish president and all the parish council. Thank you. Sorry. Mayor David Commodale of Grand Isle is here. Sorry about that, David.
Good afternoon. I have one of my councilwomen, Leota Bladsacker, drove to Grand Isle with me. I just want to thank Cynthia for really calling us up here because Grand Isle is unique, it's different. I've been through many disasters and can handle hurricanes and looking at BP and looking at my sick people, about 60 of them with cancer and diabetes on Grand Isle. The council, myself, and the chief of police, we set at a Grand Isle enforcement checkpoint and curfew, started at 12 noon. And we tried to figure out how to handle this, and we put our heads together. Easter weekend's coming around the corner. Thousands of people wants to come to Grand Isle. So we decided to get the residents in and out. You go through the list, but we got what the codes and what to come in and how to give you on Facebook of all the regulations to get in with the right IDs. But just a few minutes ago, I had a phone call with my policeman. I remind you, I have policemen on the beach, which we shut down. And through the last couple of weeks, I have many tourists, people coming from all over the United States. We shut the beach down, they still won't take no for answers. So the problem I'm having now, just a few minutes ago, we're having some people, 90% of the camp owners are following through the laws. But you got 10% that's making the phones ring with our secretaries at the town hall, our police secretaries, and the police chief's office, and they complaining why they can't come to Grand Isle. They don't realize it's not a hurricane. We talk about life and death. The town of Grand Isle has a couple of ambulances, a small police force. We also have the firemen. We got maybe 2 medics, and we ordered to, if someone catches it as we speak on Grand Isle, could be a non-resident or resident, we got to bring them to Jefferson Parish at the West Jefferson. I'm really concerned about that, but these people that's calling and question why they can't do this and they can't do that, I want you to look at me on television. If it doesn't work out on behalf of me and my council and my chief, we're not going to tolerate it. We're going to make sure that we're going to protect our people, and we want to make sure that we get this over with, because I've never lost a life as long as I've been mayor. But I can guarantee you one thing. You shouldn't question what it took us to put this together to make sure that we save our residents. Our residents that live in Grand Isle, that I was born and raised with, is the average from 50 years old to 90 years old. We want the tourists to come in. We want to make sure. But let's go through this for the next, till the end of the month, follow what the parish president wants and the council, follow what the government wants, and follow what the president wants. You know, if I lose someone today or tonight, I'll get that call going back to Grand Isle. I just want you to know that it'll be a shock for us because we're far away from the nearest hospital, which is 28 miles. And what's going to happen, we ordered to come to Jefferson Parish, and we're working things out. But I'm really upset that you question this because you want to come to your summer home. If you follow the rules, you can come. But you got some of them, my girls calling me. My secretary said some of them are very rude, they won't take that. Remember, Easter's next weekend, we'll have thousands of people want to come. And I'll repeat myself. I just feel that between the residents I have and the little law enforcement and the sheriff helping me, Cynthia helping me, the best parish in the world to belong to, thank God I have them. and I have a good governor. We got a good president that's trying to help us. But I'm really concerned. Maybe in the next few hours, we may make that call to shut everything down and batten the hatches and make sure that we're going to protect our people. So again, we're very unique, we're different. Everybody wants to come to our beach. Let's get this over with, and I promise you, we'll take care of you. Thank you so much. Now, the mayor from Harahan, Tim Boydell.
First, I want to thank the parish for putting this meeting together and everything they've been doing to support us throughout this event. It's been tough for everybody, but I think we'll get through it. In Harahan, we have a large senior population. We want to assure all our senior citizens that even though the offices are only open by appointment, we are there to take your call if you need us. And we are practicing social distancing within our office personnel as well. We're keeping the office completely sanitized and making sure we follow all CDC protocol. So please call us if you have any concerns, and if we don't have the answer, because we may not have the answer, shucks, I don't know if any of us really got a lot of the answers now, but we will go out and we'll work as hard as we can and we'll get you that answer or find the resources to go out and obtain it yourself. Small business is the backbone of Harahan, and we will turn every stone searching for any help available. We have enlisted the services of an advisor dedicated to help navigate the SBA process so we can return better and stronger. On a positive note, it's inspiring to see our businesses working so hard to thrive in our community, supporting them in a responsible manner. It has been really nice to come back and watch your restaurants and everyone standing 6 feet apart and following the rules. And as long as everyone follows the rules in Harahan, I think we'll be good. Harahan United has always been my goal, and we will win this war, and we'll be stronger and more united than ever when we get this done with. Thank you. I'm sorry. Mayor Timmy Kerner from Lafitte.
Thank you, Mayor. First and foremost, I just wanted to acknowledge and thank from the bottom of my heart all of the doctors, the nurses, the x-ray technicians, the therapists for being on the front lines and risking their lives to help others. They are the real heroes, and they have my utmost gratitude. I just want to let them know that their selflessness and bravery is not going unnoticed, and we are forever thankful. Secondly, I just really want to thank the parish president, who has been on top of every issue. She has been, from the beginning, the one stressing the importance of this and how everyone should take it seriously. She's worked closely with all the local leaders, keeping us updated on all, everything that comes out, all information. She's also helped us adjust to the decisions being made by national leaders at the highest stages so we could better serve the public. So really, I think if it wasn't for her taking this so serious in the beginning of this, and that Jefferson Parish would be much worse in condition that they currently are in. And I think serious times call for serious leadership, and she's been that for us. So thank you, Parish President, and thank you to your administration. And just to end on emphasizing on what the Parish President has been stressing this entire time. Please be cautious. Take this seriously. Practice social distancing. Stay home. You being responsible right now can save lives, and possibly your own family's lives. So please be responsible. Every day we don't buckle down is a day that's added on the back end of this, in which case we will have to buckle down. And every day this is prolonged, lives will be cost. There will be more lives gone. There will be more strain on small businesses, and there will be more damage to our economy. So please listen to your local leadership, listen to the experts, do your duty, and let's really work together by staying apart and getting through this. And on a positive note, it's really been amazing to see everyone coming together, and especially in my community in John Lafitte. I've seen firsthand people making PPEs and face masks for the hospitals before the big shipment of PPEs came in. And it's really wonderful to see all of us working together. It shows how strong this country could be when we're united, working together. And I think it also shows that our best days are ahead. And we will get through this. But thank you. That's all I have. And Mayor Peoples, let's we go.
Thank you, President Shang. I'd just like to say on behalf of myself, the Chief of Police, and our City Council, I'd like to first say thank you to our citizens in West Wego who are staying home and doing what they're asked to do to help curb this disease that's going around. And I want to say this to the ones out there who have chose not to. Close your eyes and look at the person that you love the most in your entire life. And then imagine never seeing that person again because they got this virus, okay? You can't go stand next to them in the hospital and hold their hand. You can't go to their funeral. You can't see them ever again. Imagine that. And if that don't bring you inside and have you sit on your sofa with all of the things that we have in this world today, social media, television, games, I mean, I can go on and on. You know, find a way to keep yourself inside, keep yourself safe, and keep your loved ones safe. Protect the people that you love and that, you know, your children, your mother, your father, you know, it's on and on. You know, we all have a job to do, and we have to be out to do this job, but we do it, you know, we go home and we practice the same thing. We're practicing it here today. So I just ask you to think about that. And I'm going to say it again. You know, tonight when you're sitting on your sofa or wherever you may be, if you're out in the middle of the street where you really shouldn't be, close your eyes and picture that loved one, your wife or whoever it may be. Picture them in your eyes and picture never seeing them again. And I hope when you do that, you go inside and stay inside until you're told that it's safe to go out. And that day's coming. We're going to have it. You know, we're going to go through this. We're going to make it. Unfortunately, there's some people that's not. So let's keep as many people as we can here on this earth with us by just following the simple directions. And that's really all I got to say, other than thanks to the citizens who are doing it, and all of those who aren't. Please just let's do it. Let's do what we got to do. Thank you.
Thank you. I want to thank all the mayors for joining us, and you can certainly see the strong leadership we have throughout Jefferson Parish. I want to echo what Mayor Carmardell said about Grand Isle. You know, it's very crowded in Grand Isle because some of the people who have their homes down there, their second homes down there, the kids are off for school and they went down there. So you compare this March to last March of Grand Isle, and it is very crowded. It is not the place to be. I love being in Grand Isle, but there is no medical community in Grand Isle that is going to be able to support this crowd. I was there last summer for the Tarpon Rodeo. I got sick. It was a 40-minute drive for me to get to an urgent care. So this is no place to be with the health crisis that we have. You need to be close to a medical community. You need to be close to a hospital. Dr. Cantor can say, and everything I've learned about this disease is you almost can think you're getting better and you have fever for quite a few days and then you go down very quickly, and before you know it, you're on a ventilator. So this is no place to be away from your hospital resources. And so as much as I love Grand Isle, I'm going to encourage and say that time and time again, that is not the place to be during this time. Okay, with that, I can open it to any questions that you have for any of the people who are up here. Anyone? And we have a microphone that we're passing around. Yes.
Madam President,
Yes.
This is from WDOSHIP. Question, it might be better for Sheriff Pinto.
Absolutely.
Just tell us if there's been a heavy impact on their ability to secure and patrol with that many people affected by the virus, and has any of your healthcare workers or other first responders taken a hit?
Okay, Sheriff?
Calls for service, comparing them for January and February of this past year, we had approximately 17,000 calls in each of those months. So our calls for service are about average of what is coming in. Now what is increased and decreased is a little bit different. EMS calls probably increased about 800 per month in the month of March, and that's a direct relation of a decrease in JPSO calls. So we're having a slight decrease in calls for service. I do say crime itself is down, but not necessarily calls for service. I mean, we handle 400,000 calls for service. You can imagine that we have a lot more deaths that we're handling because of the COVID-19, but we're also handling a lot of other calls for service, not necessarily crime. We still have people out there committing crime. We're still making arrests, and truthfully, we're making I would say a better and a quicker arrest because there's less vehicles out there. It's easier for us to catch them. So we've been doing a good job of that, but we want people to stay inside. Make sure you know where your children are. We don't need them out and about at 2 o'clock in the morning committing burglaries. That it's something that we want to make sure we can have as little bit of contact as possible. I'm not sure about EMS. As I said, we have been able to move from JPSO's standpoint, we've been able to move our personnel around. We have the courts are closed, so different bailiffs have been now working in the jail and being able to supplement that. Most of my detective bureau is either working home or working from the call out when they get called out for specific crimes itself. Then we have different divisions that we will be able to backfill on our operations side, but I have not allowed that to happen yet because I don't know what I'm going to have 2 weeks from now. So right now we're okay in operations. We still have enough personnel handling the calls for service. It has not affected our response time by any means. But if we do end up having a large breakout within one of my districts, I have the extra personnel to be able to move to there. I just haven't rotated them in, just making sure that we're not having enough exposure that we don't need. Yes, sir.
Delay. We're getting calls from people who went to the Alario Center to get tested. They're having a significant delay trying to get those test results, but also the issue going on with LabCorp and Quest. Some people are saying, too, that the number that they're supposed to call directs them to 311, to which somebody says, we don't know, and to check a website. So if you could kind of address that confusion and what's going on with that.
So I have to be honest, this was probably, a little disappointing for us, that we were able to be part of a federal pilot program. Jefferson Parish had the one site, Alario Center, and then the other 2 sites in New Orleans, which now have been consolidated to one. So total with the 3 sites, we're able to still do 750 tests a day. And it's been incredible endeavor by so many groups to take great samples and to get them sent off and to go to capacity every day. But once it leaves those sites, it goes to Quest and it goes to LabCorp. And we have had difficulty, and it was always our concern. We were told it was going to be a 3 to 5 day turnaround. And we have honestly had difficulty in getting especially the first weekend results. Okay, so not this past weekend, but the weekend before. Those are critical days because we prioritized healthcare workers and we prioritized first responders, and we are not getting the results and we're not getting the answers. And we hear it, sort of informally. If someone said they got a result, so then I know, well, somebody who tested on Monday was called. And so we believe that the following days it kind of cleared up and it's following a pattern, but those first 2 days have been an issue with us. Now, we've been on the phone with the colonel, and he did indicate today that he is sending a major down to help us look into this more specifically. But it's been difficult. I think our test samples go to Dallas, and it has been a struggle for us, and it has been a concern. People are calling our council offices, and we've known this is a problem. So everyone understands the issue. Everyone understands how troubling it is, and we are pressing to get this issue solved. But other than that, I'm sorry, I can't give, we have been wondering for over a week what's been going on with this. So again, they did put that number out there, and I'm hopefully with additional resources and the major coming down to really look into it and be the one who, we didn't sign the contract, so it's difficult for us. I believe the contract may have been signed by the federal government. So that's been part of our communication problem. But, incredible effort by the boots on the ground in going to capacity every day and getting what they need. But that part of it is just unfortunately out of our control. Yes. Any other questions? No? Well, I thank you for joining us again, and please, as we know, we are not out of this. Many of us have been affected, and as the days go on, and I ask people, unfortunately I'm hearing more and more people say my family member's in a hospital, someone I know died, and this is starting to affect all of us very, very personally. And again, I know the weather's gorgeous and you want to get out, and everybody has cabin fever, but now's the time to be strong and to stay in, and to please abide by the rules for the sake of your loved one and for the sake of the medical community and lowering that volume that they're going to have to see in the next weeks. So thank you very much.